Just record this. Okay, terrific. So thanks everyone for joining us today. My name is Amy Harris. I'm the manager of the Patient-Centered Primary Care Home Program, and we're really pleased to be able to offer this learning collaborative webinar series about our new standards that will be implemented in 2025. So I'm going to turn it over to my two colleagues who are going to tell you about PCPCH Standard 1E electronic access.
Thank you, Amy. Good afternoon, everyone. My name is Alicia Tavares, and I'm a verification specialist for the Patient-Centered Primary Care Home Program.
And I'm Suzanne Jefferson, an improvement specialist with the program. And thank you so much for joining our webinar on PCPCH Standard 1E, electronic access.
Slide. First, I just have a few webinar logistics and Zoom etiquette reminders. The webinar will be recorded and uploaded to the PCPCH program website. If you are having any technical difficulties, please private message Amy Harris for help. If you feel comfortable, please have your camera on and put your name and organization info up. Any questions or comments you have can be put in the chat, and we will answer them during the question session. Slide. So here's the agenda for today's webinar. I'm going to start by providing a brief overview of the 2025 PCPCH recognition criteria. Next, we will deep dive into PCPCH Standard 1E electronic access. Next, we will share additional PCPCH resources and upcoming learning collaboratives. Lastly, we will have some time for your questions. Next slide. The Patient-Centered Primary Care Home Program was established in 2009 by the Oregon legislature as part of the state's broader health system transformation strategy to improve access to care, reduce costs for patients, and improve population health. The standards are developed in partnership with an advisory committee and have been revised 5 times since 2009. The 2025 PCPCH standards were developed to support OHA's strategic goal of eliminating health inequities by 2030. The standards specifically help primary care practice build their capacity and processes to address inequities in their patient population. All practices applying or reapplying for PCPCH recognition after January 1st, 2025 must meet these new standards. For more information, I would encourage you to watch the recording of the 2025 PCPCH Standards Overview webinar, which is on our website.
Today I'm going to review PCPCH Standard 1E, electronic access. PCPCH Standard 1E is in core attribute 1, access to care, which means from the patient's perspective, healthcare team, be there when we need you. The intent of Standard 1E is, when surveyed, patients indicate an electronic access to their health information and electronic communication is highly desirable. A primary care home striving to provide access in the form patients prefer should facilitate communication through a patient portal and provide access to health information electronically in an accessible format. Standard 1E is a check all that apply measure, meaning your practice selects all levels that describe your practice activities for a maximum of 15 points. The first measure is 1E1. PCPCH regularly communicates with patients through a patient portal. This measure is worth 5 points. And measure 1E2. PCPCH provides patients with access to an electronic copy of their health information in an accessible format. This measure is worth 10 points. Measure 1E1 is unchanged, so that for the rest of our webinar, we will focus on measure 1E2. Next slide, please. To meet measure 1E2, a practice must provide patients with access to an electronic copy of their health information in an accessible format. Patients can view, download, and transmit their health information online in a timely manner and in an accessible way. Health information includes things like lab test results, problem lists, medication lists, and medication allergy lists. Electronic health information should be available in languages other than English and have alternative formats accessible to patients with disabilities. For example, many patient portal interfaces have multilingual functionalities that make them accessible in Spanish and other languages, or have features such as large print and contrasted color for visual impairment. Practices with electronic platforms that have limited real-time translation or formatting capabilities could meet this measure by demonstrating a process by which electronic health information or portal communications can be translated, interpreted, or read to the patient upon request. Practices must demonstrate how their patients are made aware of the accessibility options available to them.
Slide. Here is an example of a clinic successfully implementing Measure 1E2. A practice uses the portal features in their EHR for patients, family members, and caregivers to view records and lab results, ask questions, and request appointments or prescription refills. The EHR is enabled with a feature where this information can be translated into languages other than English on demand by the patient, which patients are made aware of in their welcome packet and in the portal itself. Every day, the practice responds to requests from patients, families, and caregivers to view items that are not visible or displayed within their patient portal. Next slide. Here is another example to meet 1E2. A practice has a written protocol for how to ensure that patients can access their health information in an accessible format online. In every new patient packet, the practice includes a document explaining how patients who need to access their health information in an accessible format can contact the community health worker or patient navigator at the clinic. When contacted by a patient, the community health worker or patient navigator assists the patient in assessing their health information online using relevant tools and resources such as connecting the patient with an interpreter, reading the health information to the patient directly, or ensuring the patient has access to screen reading software. Slide. Next slide. Oh, no, back. Sorry. Okay. This next slide is on 1E2 documentation. So at a site visit, you will be required to provide documentation to the PCPCH program demonstrating you are meeting the measure you attested to. As a reminder, when you are completing your PCPCH application, we strongly recommend you gather and save all documentation that would be needed for a site visit. Here are some examples of documentation that could be used to show your practice is meeting 1E2. I also want to touch on the term accessible format, as this will be different for every practice and it will vary based on your patient's needs. This is why we kept the documentation requirement open and revised the intent to include both electronic access to medical information and electronic communication with provider or care team. Examples might include a screenshot or other documentation demonstrating that a practice's patient portal is compatible with screen reading software that enables a blind or visually impaired user to read the text that is displayed on the computer screen with a speech synthesizer or braille display. A screenshot or other documentation showing a practice's patient portal can translate health information into languages other than English. A policy, protocol, or workflow describing how patients whose primary language is not English or patients who have a disability can access their health information online and how the practice communicates these options to its patients.
The PCPCH program is hosting this webinar series to assist practices and other community partners in understanding the standards in our 2025 TA guide. Webinars are scheduled every other Friday through December. You can find a complete list of topics and registration information on our website. The next 3 webinars are listed on this slide. We hope you join us and bring lots of great questions to these webinars, but know that they will also be recorded and posted on our website if for some reason you can't join us. Next, there we go. The final slide here is a list of additional resources you may find helpful. First is our PCPCH program website. The second is the 2025 TA guide with detailed information about how to implement every measure and the documentation requirements for those measures. Next is a link to our TA resources webpage. And last, you're always welcome to reach out to the PCPCH program with any questions through our program email. And I think with that, we'll open this up for Q&A with our participants.
So if folks have questions about the standard or how you would implement it in your practice, you can just drop those questions into the chat. If you need additional clarification, we'd be happy to answer anything you want to know about this new standard. I'm not seeing anyone answering and asking any questions. So that must mean that Suzanne and Alicia did a great job at covering the basics. I don't know, Susan, would you like to stop sharing your screen and then we can have more of a great. Thank you. We can just wait a couple more minutes to see if folks have any questions about this standard. It looks like I'm just reading the chat. I got a private message from someone on my team who's offering to provide some additional information. That would be great, actually. So I'm going to actually have Rachel, who is a member of our team, provide some additional information on this measure. So Rachel, feel free to unmute yourself.
Yeah, so I just wanted to speak really quickly just to the point changes and some of the structural changes. So, as the team mentioned, 1E1 hasn't changed in terms of the specifications, but it used to be 1G1. And so that's why you might recognize it, but it didn't used to be included in this standard. And it's always been 5 points. So those specifications are worth the same amount of points. But the measure that's currently 1E1 in the 2020 specifications was bumped up to 10 points due to those additional accessibility expectations. And so that's why you'll notice that the new standards has 2 measures instead of 1.
Great. Thank you so much for that, Rachel. That additional context is really helpful. So it looks like there is a question in the chat. So the question is, this is what our EMR has advised me about the screen reading software mentioned. Screen reader software can parse out any web browser page. If they want to prove it to themselves that we are correct, then they'd have to purchase a screen reading software like JAWS. Can you expand on what is required with this to meet the specifications? I'm not exactly sure I understand what you've written, Christy. I don't know if you want to unmute yourself and maybe elaborate a little bit. Are you saying that the patient would have to purchase JAWS?
I can if she's, because I had the same question, and if she,
oh, great.
If she needs to in the chat, but no. So I think back on the slide where you talked about documentation requirements, one of them was, providing documentation that the EMR can be read by accessibility software like screen reading software. And what the EMRs are saying is, yes, screen reading software can read any thing, and the only, like, they don't know how to prove, we don't know how to provide that documentation. So what the EMR vendors are saying is, well, if you want to buy JAWS, you can. There's no way to, they don't have a document that says this is accessible to be read by this, because it just is. Does that make sense? So I think it's a documentation. question.
Yeah,
Telling us,
yeah,
yes,
yeah.
our software is compatible, but we don't know.
yes,
Has flour in it.
yes, that makes
Feels
sense.
like flour.
Yeah.
Because what else would be the thickening agent other than cornstarch?
Cheese.
Oops. Would folks mind muting themselves unless you're asking a question? Thank you. So that makes sense, Kimber. Thank you so much for adding to that. And it looks like, oh, good. I see Christy also thanked you. She doesn't have a mic. So that's a great question and not something that we were aware of. So I don't know. I mean, I think we'd have to think about what kind of documentation we would need to see, you know, either from the practice or from the vendor that would demonstrate that. I think that makes a lot of sense. That, you know, they might not have that sort of proof that you know, it can be read by a screen reader on the patient side. So let us think of that through a little bit. I don't know. I certainly would be willing to see if any of the verification specialist staff on the call or improvement specialist staff from the team have any ideas right now. I mean, I don't know, Amber, I see you nodding your head. If you,
I was just, I was
Okay.
thinking if you're working with a patient that's in that scenario, you might have an open telephone encounter in their chart where you might document patient has access to screen reading software and is able to access whatever it's, that they're wanting to view in that way. So it might be documented a different way. It might be in a chart note. It might be in that patient screen, an alert that comes up that you have a pop-up on your alerts that this patient is visually impaired and has screen reading software. And you could take a screenshot of that in their chart that demonstrates it in a different way. So I think we're going to have to kind of all look at it in that kind of manner of, how we can work around it and still demonstrate that patients have that kind of access.
thank you for adding that. That makes a lot of sense, Amber. And thank you for that question. Okay, so Christy said, what if we don't have patients or patient examples during attestation that need that kind of access? Yeah, that's a great question. So we often see that. And I think that, as long as you have the capacity to do it and the capabilities to do it, it doesn't necessarily mean that you have to have the patients that need that at that time. So we would just be looking for that. Can you do that at that time if it's needed? So you don't necessarily have to have the patients who need those services, but would you be able to, we would want to know if you'd be able to provide that if you have those types of patients that come in your door. So. Great. Yep. Good. So the other question was, would a workflow or policy with a plan to support those patients be sufficient? And the answer is yes. I answered that. Perfect.
There's a question from Maria.
Yep.
What do we recommend for patients over 14 years old with disabilities when parents are denied access to the patient portal due to the patient's age? And I think that's also a question that we.
Yeah, I think that's a good question. I mean,
Great question.
I know, I think that is a great question. I know as a parent of a teenager myself, I do have access to my child's patient portal. They had to give me that access. So I think, but that might not always be the case, obviously, for children. So I think we'd have to think about that. That's a good question.
Hi, Amy. This is Maria. Hello, everyone.
Yeah.
Hey, on that same question, I guess the other question is like, what if that teenager or patient is nonverbal and they're not able to provide consent or access to the parent? Because we have several of those patients, very complex patients.
But with confidentiality
But
requires.
with confidentiality, they require that we only give access to a certain age.
Yeah, that is a good question. I mean, I think that, we would want to look at, are you able to meet those needs for most of your patients, for the majority of your patient population? And so I'm not sure if that's if you have a lot of patients in your practice that fall into that category, we would want to look at perhaps how you would be able to meet that unique need. But I think, in general, the process that we would be looking at would be the same. Do your patients in general have access to that, to getting their health information in an accessible format?
Okay, thank you so much. I appreciate the answer.
Other questions folks have? These questions help us to learn as well. Like, we certainly had not considered the access to the portal for children under 8 or under 14 or 14 and over. So that's actually a really great question. We really appreciate that. It helps us to learn and think through some of those as well. Things that don't always come up. We try to come up with as many possible scenarios when we're meeting with our technical advisors who help us develop the specifications, who are all in practice. They all work in primary care practices. So we try to come up with as many, scenarios as we can, but we clearly don't cover everything. So it's really helpful to get your questions so we can make sure that we're taking all those things into consideration. So.
Hi, Amy. Can you hear me?
Yeah.
My name's Danny. I'm a population health manager with Yakima Valley Farm Workers Clinic. I had a comment in regards to, I'm so sorry, I think her name was Maria, in regards to like a patient who's nonverbal or might be special needs. I can let you guys know what we do in our practice when we need to grant access to a parent or legal guardian in those cases. We have a consent form for my chart. And there's a section at the bottom where it's specifically asking for the patient's PCP signature and like approval to be able to do that, because it's, it's like a healthcare need. The child may not be able to consent due to whatever the issue is, or not issue, I'm sorry, but like whatever the condition or reason might be. And we have, those are small cases, but that's kind of what we do in those cases so that we're still able to grant someone access to the patient's MyChart portal. So I don't know if like other organizations do something similar to that, but maybe that's something that they can look into if that's something that they're running into.
That's great, Danny. Thank you so much for sharing that. And that's something that maybe we can share in our TA guide, perhaps, or as we're working with practices, we could share that with them as well. In fact, if you don't mind, I might reach out to you afterwards for a little bit more information about that process, if you don't mind.
Yeah, of course.
Yeah, great, thanks. That's very helpful. Other questions folks have? Or comments? I know folks are probably just starting to dig into the standards and read them and process them and think about how to implement them. So please, as you're doing that, never hesitate to contact our program. You can email us directly into the inbox. You can call us. We're happy to have one-on-one conversations with you. We're happy to come and talk to you at any time about how we can help you implement the standards. This standard and any of the others, although we do have upcoming webinars, but you can still ask us questions before the webinars as well. We can definitely answer questions about any of the standards as you are digging in and getting to know them a bit better and trying to figure out how to implement and operationalize them in your practice. Okay, well, with that, I think we'll just end today. This will be recorded, or this is being recorded, so we'll upload it on our website if you want to rewatch it, or if you have others in your organization that you'd like to watch it, please feel free to share it. It should be uploaded by early next week on our website. And then our next webinar is coming up in 2 weeks. And so again, same time, every Friday, every other Friday from 12 to 1. So we hope that you'll join us. And again, you feel free to reach out at any time with questions. So, all right. Thank you, everyone. Have a wonderful afternoon.
Thank you. Take care.
Thank you.